Good afternoon. Thank you for creating time for us. You are in time for the lunchtime news. A very warm welcome to the broadcast. My name is Irene Mchuma Odim. On sign language interpretation, we have Lensa Odingo. It is the 9th day in the month of July 2023. The anti-government protest reactions continue to pour in the newsroom. This as political leaders continue to traverse the country. Wiper Party leader Kalonzo Musyoka is in Embakasi, the county of Nairobi. We have a able team on the ground. Let's interact on all our social media platforms at KBC Channel 1. We begin with the health workers' plight, where we are having a press conference in the county of Nairobi. My colleague Timothy Kipnusu is with the health workers, and let's cross over and listen in.
The real soldiers of the disease prevention and the public health officers, whom they are supposed to work in line with those community health promoters. We should not say, for example, put aside money to employ community promoters and then say you don't have money to employ PHOs. Because at the end of the day, for us to achieve maximum work output, the community health promoters must work in tandem with the public health officers so that we have a great work output. So I believe maybe the president has the right, is the right way to go. But we must now have a formula on how now the COG can talk to the various county governments so that we can be able to actualize that dream. Otherwise, it's going to remain a pipe dream.
And also the COG has actually been copied as a stakeholders in all these communications, all these deliberations. So I think as much as they have the autonomous authority and such, they should actually be willing to bend. Because you know, sometimes you want your county to be run in a specific way, but we have experts that are advising another way. So you come to an agreement, you sit down with what the expert is proposing, what you have on the budget, because at the end of the day, if the budget allocation is not there, then that cannot work. But fortunately enough, we had that allocated, so maybe the COGs and should actually deliberate on that as well.
Thank you so much. I think members of the...
Okay.
Yes.
For that health sector,
yes.
Is it going to be the all health workers going to be strike?
It is the entire... as we look at I'll give this... We have everybody. We have the KUKO, we have public health officers, we have everybody going on strike. It's not for anybody. It's not for PHO or nutrition. It's everybody going on strike on 13th of July. It's everybody going on strike.
But you know, as he has said, we are not for the perennial health worker strikes. You know, unfortunately, there's that notion that Kenyans have that healthcare workers wanajipenda. You know, you get to wonder. This is someone who has, like, for instance, the UHC staff. They have been working for more than 2 months. 2 months, 60 days without any pay. Like most of them, they're not even sure, because there's that mishap in communication. The public service is telling them that we're going to give you 1-year contract. The COG is telling them we are going to give you 3 years contracts. And you see, with the confusion, it's becoming a problem with this dispatchment of pay. So, sio kujipenda. We know, as much as everyone wants what's best for them, and you cannot expect a healthcare worker to work to give you the best services if they are not okay themselves.
And again, we care about Kenyans. We care about Kenyans. When we are calling about employment of quite a big number of healthcare professionals, what are we saying in a nutshell? We are saying we care about our country. We don't want our people to suffer from diseases that can actually be prevented.
Health unions threatening to down their tools by 13th of this month if their concerns are not addressed before then. My colleague Timothy Kipnusu is on that bit. Be sure to catch up with him in our subsequent bulletin.